Hello, my name is Jekia Jackson, and I am a freshman at Georgia Perimeter College. And today, I will be discussing concussions. What is a concussion? How to prevent a concussion? What are diagnosis and treatment processes, you might ask? I would like to pose you all a question. Have you or anybody that you know ever received a concussion before? No? Me either, but I do know numerous amounts of athletes who have received concussions, such as Paul George and Ted Johnson. Concussions come from the Latin word concutire, which means to shake violently. WebMD classifies concussions as the most common, least serious brain injury, but to me, any brain injury should be taken very seriously. Some warning signs and symptoms of concussions are persistent headache, drowsiness, slurred vision, slurred speech, memory loss, sensitivity to light and sensitivity to noise, and sluggishness. There are 3 types of concussions. Mild, which is also called a grade 1 concussion. That means your concussion symptoms last less than 15 minutes and you lose no consciousness. The second one is called a grade 2 moderate concussion. That means that your symptoms last longer than 15 minutes, but you still lose no consciousness. The third one is a severe, which is a grade 3 concussion. That means that you completely lose consciousness, no matter for how long. It could be a few seconds or a few minutes. Most concussions are not life-threatening, but it is very rare. But you can receive a blood clot after you have a concussion, and that could be life-threatening if it's not taken care of immediately. Concussions come from a direct blow to the head, whether it's by fall, by car accident, or a contact sport. According to the CDC, between 2001 and 2009, an estimated 200,000 teens under the age of 19 were hospitalized due to an injury from a contact sport. Mayo Clinic states that you can minimize your risk of having a concussion by wearing the appropriate protection. Wear protective equipment when participating in high-risk, high-contact sport. Wearing a helmet can lower the risk of a traumatic head injury by 85%. Ensure the equipment is properly used, properly fitted, maintained, and worn consistently. Drive and ride smart. Always wear a seatbelt. Obey posted speed limits. And never use drugs or drink alcohol while driving because they can impair reaction time. Also, do not fight. Abundance of concussions are sustained during assault. Symptoms of concussions can be very, very vague. And there is no definite test to tell if you have a concussion. Diagnosis is basically based off of history of head injury, physical exam, CAT scan, or MRIs of the head. And in conclusion, I hope that you all take concussions very seriously. So if you have any of the symptoms that I listed, please contact your doctor. I hope you have a clear and concise understanding. And it was been a pleasure speaking for you all. Thank you.